there, everybody. It's Jenny Clark with GovCon Summit today. I'm honored to be with you with Olu Phillips and Ashley Gillis, who have a presentation about global health emergency preparedness. We've all gone through this horrific global pandemic nobody could have planned for. This isn't the first time and it won't be the last. And that's why I asked them to come on and do a presentation about the work they've been doing with the CDC and other health organizations and what needs to be done for these responses. So Olu Phillips has SIS, he's in St. Pete, and he is the prime contractor with CDC and has been working with Ashley Gillis. And I would say it's under curriculum development for how to train professionals in this medical community to respond and how to make it a global response, how to translate that, and all of the ways that you get the information out. So let me go ahead, Olu, and let me turn it over to Ashley. I'm gonna let her introduce your team and what you're doing, and we'll go from there. Ashley, you can take it away.
All right, thank you. I'm sharing my screen. Can everyone see it okay?
Yes.
Excellent. Okay, so we're going to talk about global public health emergency management capacity development. And basically, as Jenny said, this is about how you respond. It is how you are prepared for the next pandemic, which it's not will we have it, but when we have it. I'm sorry. Okay. So Olu, why don't you introduce yourself, please?
Certainly, and thank you very much. I'm quite honored to be part of this very important discussion. My name is Olu Phillips. I'm the CEO of Strategic Innovative Solutions. It's a mouthful, SIS. We are based out of Clearwater, Tampa Bay area. We are an expert in health sciences and research, public health technology solutions. And we've been actually a partner to both Anchor Point and the CDC and several other agencies across the world during this pandemic. Again, I'm here to share our experiences, our thoughts, the next steps, etc. Thank you so much.
So I'm Ashley Gillis with Anchor Point Learning. And I have been working with the CDC on this topic, developing curriculum since 2017. And as you can imagine that you are taking a course in something or developing curriculum in something that's so amazing and huge is a pandemic. You never thought you would see it come to life, or at least you crossed your fingers and hope you didn't, but it did. And when it happened, it changed a lot of lives. And immediately what happened in our area is the data started rolling in on what we need to do as far as doctrine and training and getting people up to speed to respond to this. So I'm going to give a little background about what is public health emergency management. So public health emergency management is a program. And in that program, it's about anticipating, preventing, preparing for, detecting, responding to, and controlling and recovery. This might sound familiar to folks with a military background as like an incident command. It's an incident command system for a response. The consequences, what they're really trying to help avoid is, to minimize the health, and and the one that we've all seen is that economic impact. So you can imagine that from a global standpoint, this applies here in the United States, but all across the world. So let me give a little bit of background. So back in 2005, the world came together and said, you know what, we need a set of international health regulations. And this IHR, as it's called, is a legal document. And it's a legal document between 196 member states. And these member states have committed to a core capacity. And here on the screen, you'll see the list. We talk about the national legislation and policy, the coordination of that national focal point for communication. We look at surveillance, response, preparedness, risk communications, human resources, and laboratory. So if you think about that pretty much covers every aspect of this pandemic. I'm going to pause for a second. Olu, would you like to add?
Certainly. So again, Ashley and Anchor Point have been an integral part in planning for what is next. And we cannot do as much as we've done to prepare for what we've experienced this past year and a half. So what has come to really be of use is the planning and anticipation. While we did not anticipate COVID-19 and its impact, I believe some of the steps that have been taken in activities such as SIS's Fellows Program, where we support international organizations, international public health agencies, I believe has helped us in our response activities, in our emergency response activities. And I will let Ashley continue to delve into that. And I'll be very glad to share the challenges that we experienced. I think when the pandemic occurred, we, SIS and our team has several fellows from about 10 or 12 countries in the United States that we had to get back to their respective countries to help address COVID-19. So Ashley, go ahead, please.
Exactly. So what Olu was doing, the CDC has a fellowship, and when those people around the nation come in, they go through about 3 months of intense training. And so how Olu and I work together on this is he runs the show and I come in and I support with the curriculum development for this. You would think with something like this, public health emergency management, there would be a lot of curriculum out there. Not really. And what's amazing, what I have just been so excited about is the World Health Organization is using our materials to stand up their own center of excellence. So why do these international regulations matter? I think all of us have experienced the health threats have no borders, right? And all of us have experienced the control of this and how it seems like it's completely out of hand. And that's one area where when you meet the capacity in the IHR, then this is something that it will help deter. So let's talk about travel trade, right? So even your ships coming into port, it gets stopped during this. Think about all the things that just stopped. And on our previous call, we were talking about the impact on our own healthcare system where people, think about the people that were in the middle of a cancer treatment, then they couldn't get to the hospital to get their cancer treatment. So it really is about the human and the economic damage around what this has done. So then we look at those early warning systems. And what is so amazing, and I think if you talk to anyone who's had experience in responding to this, is that we did not have the infrastructure. We talked about on our previous call, on our previous presentation, we didn't have the infrastructure to get all those health records and all of those things coming in so that we could aggregate the data and say, okay, what is going on? When you have countries that are supposed to when they have an outbreak, they're supposed to report it to the WHO within 24 hours. That's part of the IHR. But a lot of that didn't happen. And I think most of you could have saw that in the news where people were coming in late saying, oh yeah, now we have it, now we have it. So that goes to the next one, was keeping the threats under control. And that is through communication. It is through a quick response to it. And while we had these systems in place in the United States and there were some abroad, the problem was there's such a huge disconnect that there wasn't a synergy in not only going out there with the rapid response teams to figure out what is boots on the ground, what's going on, but just in general, we just weren't talking to each other. So I'm going to, Olu, if you will take this last one around how all of our countries benefit.
Certainly, and thank you again, Ashley. So I believe one thing that we've all experienced, especially these several, at least for the last decade or more, is the fact that the world is a global village and we are all in it together, and nothing could have Fortunately or unfortunately, I think the COVID-19 has proven that the world is truly a global village. So why are we all in this together, and why do all the countries and the world has to work together? As I have mentioned, the Center for Disease Control took the lead on this and said, how can we address the next public health event, and how can we respond to them without having to find people to go abroad to help the respective countries? That is what led to the very noble approach of the fellowship program, where Anchor Point has been an integral part. So what we do again is that we bring, rather than us taking the solutions to the countries at the last minute and reactively, it was a proactive approach to say, bring everyone to the United States from this respective country, put them through a very rigorous, and these are generally fellows, medical doctors, public health experts, pull them through a very rigorous training process for 3 to 4 months. And that way they could go back to their respective countries. And by doing that and going through the curriculum developed by Anchor Point and the CDC and other world regulatory bodies together, I believe that has actually helped us to address the events, especially COVID-19. And again, bottom line is that we are all in it together. We are all going to develop these curriculums together, and we are all going to attack these events, which is COVID-19 and any other public health epidemic in the future. And again, Ashley, I'll pass it on to you so we continue.
Does anybody have any questions so far? Okay.
I just popped up a poll to ask people if they're involved in this type of work and would they want a follow-up on this topic. So we'll see what people want to say about that. But I think that what we're really challenged with is you guys are doing fabulous work. It's very important, but the cost to pursue that work is keeping you from expanding your footprint. And what we were talking about earlier, especially in conjunction with the last session with Dr. Tony Hess of Deepwater Point, is how does small business team up to get these opportunities? Because I don't know about you, but I'm like, number one, I have to be able to get the work that I'm able to do. And sometimes pulling teams together is just, it's out of my range and out of the, but I've got 3 people voting and I'm just going to put it on pause and let the polling keep going. Go ahead, Ashley.
Okay. So we talked about the public health emergency management program. So the next part of that is what we call a FEOC. It is a public health emergency operations center. And I put these graphics up here to show you about the world. So on the left, you see the CDC. And if you've ever been in their EOC there, it is absolutely overwhelming. And the picture in the background, you see that large, the manner of screens, it literally covers this entire wall, floor to ceiling. And that's where all of the health reporting data comes in. They have multiple people in there. As a matter of fact, this picture was taken during the Ebola response. And so you look on the other side of the international community. So you see up at the top, their PHEOC can be one room with people around one table. And then you go to the bottom and you see a country that's further developed. They have the screens. And if you can imagine during a response, this table, much like the guys at the CDC, they all have their job. There is, inside of that, you have, and we'll talk about this in a second, you have a structure that the FEM program sits inside that structure, and that's how it is conducted. So when you look at the PHEOC command structure, so if you are former military or have worked in emergency response, you see that on the left-hand side, you see this is the incident management system, and some people might call it an incident command system. But what is very different about this is focused on public health. For example, look down at operations. So in operations, you have the clinical support side of it. You have the laboratory and the epi. So the epidemiology. So under that, you have that surveillance and contact tracing that we were discussing with Dr. Hess. So on the right-hand side, this is a worldview. So this structure is at the strategic, operational, and tactical level. So on the side on the blue, so on this side, this would be like the United States' overall response to COVID-19. And under that overall response, if you think of it in terms of us, it would be like the different government agencies coming together to work on the response. And within that, what you see is right here is their Minister of Health. And the Minister of Health with their PHEOC that sits inside of the EOC, lots of acronyms. So this is what, if you look at this structure, it blows it out. It has its own entity of this structure, but all of this, your plans, logistics, everything is focused on the public health side of it. So imagine, think of FEMA, let's say responding to a hurricane, for example. So there's a national structure to that. And as a part of that, and FEMA most of the time has this, is that public health side. So like after a hurricane, you know, you have, there's a lot of potential for disease because of lack of clean water, lack of electricity, standing water in that area. So that brings us to this idea of development, the core capacity development, based on what the IHR, the International Health Regulations, are looking to. And this is where SIS has so much experience and brought me in for my little niche. And if you look at this, we're going to kind of walk through and talk about these different areas and the experience that we have in them. So if you look at preparedness, you look at this as risk assessment. So the first thing that has to happen in any situation is to do an assessment of your threats and hazards. And then after that, if you know what your threats and hazards are, it takes you into the planning process. And then you can see it goes on down to logistics, training, exercise, improve, and evaluate. So imagine this in a circle. It's a never-ending loop to make sure that we are prepared for the next pandemic. And in the countries, there are epidemics. Like we've had epidemics here right now. We're fighting the opioid crisis, which Olu can speak to because his team is working on that. So Olu, turn it over to you for the response side.
Certainly. So on the response side, again, before you even get to the response, as Ashley has mentioned, there are several steps that are taken to prepare us for these events. So from epidemics like the opioid crisis, the former administration actually put together a very noble project again, where SIS is supporting National Center for Injury Prevention and Control. And what we do there is actually we are helping the states, local government, and the federal government in gathering opioid-related data. We all know what the challenges of opioid, and I know somebody will know somebody whose family member has got either some very negative results from opioid crisis. In this response, of course, we gather the data, we provide the information accordingly, and those information on opioid usage, opioids dispensing are shared with the respective authorities and also with organizations that are helping prevent, and control the opioid epidemic. What we have actually noticed is that, again, as we have all read from the newspapers, we have seen actually a downtrend in ensuring that the impact of negative use of opioid is controlled. And not only that, also again, in the whole process, the unfortunate part is that there are also people that truly needs opioid dispensing. So recently I met someone on a flight that was sharing with me the painful process that their family went through. And his wife recently had the surgery, and unfortunately she needed the opioid, and they would not prescribe but 1 or 2 pills to her, which never really helped. So again, it goes back to where we are all working on this together. And again, how can we actually help prevent this epidemics, pandemics, what can we do in preparing for them rather than reacting to them? And so, and really one of the key things, and I think actually we'll probably discuss that in a moment, is really how do we fix the next social challenges? How do we address the next social challenges? How can we prepare for it? We can never be too prepared, but how can we do that? And how can we continue doing what we are doing effectively and rolling that further out? I hope that helps, Ashley.
Absolutely. So again, in the response, so Oli made some really great points about the balance inside of responding to the opioid epidemic here in the United States. When you look at it on a global scale, so when you have that program, that FEM program, and then you have that FIOC, you have the folks that run the program and run the FIOC, and those are our technical assistants. And what I'm very proud that Olu and I are a part of, again, is that fellowship at the CDC to train these people for that. In addition to that, Olu and I are working on an effort now in Nigeria to hold an international fellowship, and that's going to happen within the next couple of months. And that is when you train these folks to in these other countries to respond, think of it as we talk about that communications and all those things that are needed under those core capacities. That's when you get them to be able to help themselves, right? And even in the United States, I feel like if you look out there and you see all of the ads for FEMA, looking for people to help them with this, the CDC on contact tracing. I mean, there's a plethora of jobs out there. The problem is people aren't prepared for those jobs. And that's part of what this fellowship does, is help them prepare to be able to fill in the gaps of that. So the next area is around risk communications. So Olu, will you please talk about the what we're doing with the DEO, and then I'll talk about the training side of it.
Certainly. Thank you, Ashley. So with the Centers for Diseases Control Division of Emergency Operations, Ashley did share a photograph earlier with a picture which indicates the United States and Centers for Diseases Control Operational Center. And then, of course, we have our counterparts in the different part of the world, which could be a little hut to a little conference room. So what we really are doing with CDC is actually we have a group of people that help ramp up and identify the right type of resources to quickly address the pandemics. So what the Emergency Operations Center, just as it's called, the Division of Emergency Operation, exactly that is what they are. When we have these public events, which it does not necessarily have to be a pandemic or epidemic. When you look at SIS, one of the things that we have done is we helped following the unfortunate event of September 11, we helped the Centers for Diseases Control develop a kit that could be utilized in the future to track the unfortunate incidents and people that were impacted by September 11. So you have those type of incidents where you just don't have computer at that time. You don't have any other means. People's cell phone were not working, and then so what can we develop to address either a global pandemic, a natural disaster, a man-made disaster? How can we track these things? And those are the type of collaboration that we are working with the agency for toxicology in the case of September 11 to track all the people that were impacted and being able to actually trace them. We are applying the same methodology to the pandemic in the case of course, COVID-19 internationally. And again, the same thing we are doing with the case of Ebola, the epidemic. How can we track people? How can we quickly identify the right resources? That's what SIS is doing. We're supporting DEO in that aspect to ensure that the right people are identified quickly to address epidemics, to address natural disasters or any emergency situation. And then actually folks come in and help get those people to the next step, which is training. how do we get people trained on demand in time for emergency operations?
So thank you, Olu. And when you think about when he was talking about the resources, I showed you that structure. Part of that is a PIO, which is a public information officer, and a JIC, which is a joint information center. So this joint information center, once again, sits inside of that structure. And with risk communications, well, let me ask you something. I'll ask a question out there for everybody. So Jenny, get ready to, let's let them answer. When you think about the response to COVID-19 and you think of communications, what comes to mind?
Anitria said, well, Anitria just said thanks because that was about something else. I think people would have to throw something in the chat. What comes to mind when they think about global? To me, it was total confusion. That was the word I kept thinking of. And even now, it's still total confusion.
Exactly.
I agree.
And misinformation, and let's just say communications that had a huge risk to them. It's words matter, and so the whole risk communications is developing a plan, and with that plan, applying the resources that you need to that plan, as Olu was talking about. But also, it is right down to the training we provide. Talks to them about not only developing a plan, but also how to run a communication center, how to write a press release. And if you think about that for a second, most people, professionals that are thrown into a situation, and this even happens in corporate America, and people have to go out and give communication on something, and they're just not sure what to say. So that's how your rumors get started, and especially with the impact of social media. So Olu and I, one of the things that we have to offer is the whole package around developing a risk communications plan and sourcing that risk communications plan and training those people to be ready to respond. So inside of another capability that we're looking at under the IHR is human resources, because looking at what's considered under there, just things that you see in the average company, it's except it has that public health professionals. And Olu's team has sourced many types of public health officials in various countries within Africa and currently expanding. And those professionals, if you go back over to the other side where it says response, those technical assistants, so it sources those people. Olu on the information technology side, he is providing services for that also. Olu, do you want to talk about that?
Sure. So again, technology has been an integral part of our life and public health and what we all do today. And one of the challenges, and I would go back to surveillance. So a good example of the challenges and opportunities in IT or health information technology is our program on violence against children. Is another effort by the CDC, and I believe we support about 14 countries in 3 continents, where we have our expert travel to those countries from the United States to help them in gathering data and work against abuse of children. And what that effort includes is sometimes the norms in one country does not necessarily mean the same in another country. So what we are doing is that we are helping identify how can we gather data on child abuse and how can we help prevent violence against children. And one of the things that we actually identify in that effort is that while the United States have several tools where, as an advanced nation, to gather data, we have software, we have computers. When our folks travel to other countries, and I would not necessarily mention names, but they are using just Excel spreadsheet to gather statistical data. Sometimes they are using just piece of paper to gather those data. And what we are doing is actually helping them utilize the best resource that they have, either if it's a piece of paper, if it's Excel spreadsheet, if it's Microsoft Word, how can we help them gather all those data and still make sense of it and to utilize them in making the best decision available. And again, this applies to either if it's a Congo Republic, or we have had instances in Lesotho or Moldova, which is Eastern Europe. And then, India, unfortunately, they are going through some challenges now with COVID-19. Again, is how can we utilize IT, information technology, to gather the best data possible to make the quickest decision? And also that goes to the question that Ashley asked earlier, what do you think of when you think of COVID-19? And I would tell you that SIS as an organization and our partners is chaos. However, it is a managed chaos. And that's the goal. We know that it's going to be chaos, but how can we manage it? And that is where information technology comes in and help us get there.
So I want to go to the chat for just a second. Caroline, you put in your post about you worked with the as a PM with the Peace Corps in China, and the cultural differences are huge. So you bring up a really good point, 2 points. One is the cultural differences. And so our efforts on this core capacity development, right now, most things that exist are US centric. Like, for example, and you mentioned in your chat about plans. So the United States, in the traditional planning sense, has a model that they use for planning. And this model basically is evolved out of the military. And so we've taken that model and they just give it to a country and say, well, here, develop your plans this way. Well, that country doesn't have the same resources. It doesn't have the capabilities, as Olu was talking about, to collect data. They don't have what we have. And so everything that Olu and I do with this is we take, okay, this is what the United States does. This is, you could call it a standard. And then we look at these countries and say, what can you do? And that's how we help them build their capacity for it. And I'm going to go back, Carolyn, to your comment. So you're right. So the global health management, that people are creating plans they have little to no knowledge about the local population, how it works. Exactly. And what we do here is those technical assistants, they are on the ground. They go from the Minister of Health down to the communities. And we talked about those risk assessments. Those risk assessments are at the national level down to the community level. And to relate that, so here we have on the federal level, then we have the state level, and then we have below that our towns, our cities, and so when you look at that, you're absolutely right. It has to be tailored. I was on the phone with the WHO earlier, late last week, and one of the things that we talked about, we were looking at this curriculum that we developed, and the gentleman that's over it from there said, we still have to take this material and make it more international. And so he and I, and our team is really looking at how do we take it one step further, to your point, Carolyn, down to the local level, so they can work with what the tools and resources that they have to respond to it. Thank you so much for that. Okay, so so the other areas that we work within inside of human resources is pretty much typical of what we experience here. So in the we also have laboratory services, and again, we talked a lot about surveillance. So I want to go back for a second, back to the picture that I put up there. So when you talk about public health emergency management, it's got to fit into that individual country and what they have. And one of the things that this international fellowship that we're doing, there's folks coming from all over the world to meet in Nigeria. And what they're going to bring is a perspective of their country. And so what we're hoping to do, as you think about it, they're learning, but they're also sharing what's worked for them and what has not worked for them, especially in COVID, because they've all touched it in some way. So just to wrap this up, and I'll do some final words, and Olu, I'll pass it to you. Helping countries with their international health regulation core capacities. They have to develop this capacities. That is how you are ready for the next pandemic. And that's how you're ready inside of your country for an epidemic. Right now in the Democratic Republic of the Congo, they are dealing with COVID-19, Ebola, meningitis, and cholera, all at the same time. So imagine how stretched their resources are, and imagine what they're learning from that. And so that's what we want to help the world do, is be able to respond. Olu?
Thank you so much, Ashley. I couldn't have said it better than you just said. Again, the world is a global village, and COVID-19 has actually been very much a challenge, but also an opportunity. And one of the key things that I believe we've seen from COVID-19 is on the Fellows Program, the ability for our respective partners across the world to be able to quickly respond to COVID and manage it. And also, as we are continuing to develop, another area that Anchor Point has extremely shown our ability to change quickly is being able to take all these curriculums and convert them quickly into several languages, including Russian and African and several languages, and help those partners. So my only point here is at the end of the day, the world is a global village, and we are all in it together, and we need to all start planning for what is next, sooner rather than later. Thank you so much.
So, Jenny, are we going to open up for questions, or let's have some?
Well, certainly I would love to get some questions from some of the attendees, and I'm glad to see that we've got Muriel Scott on here. And Muriel, I wondered if you had any questions, or Anitria. Anitria has a background with the teaching side in a very similar way and has past performance in this area. Anitria, I'd love it if you'd pop on and say hello for a few minutes, because this is really all about how do we move forward together. There she goes. You're on mute.
Certainly. Good afternoon, everyone. Fantastic presentation. Yes, my company, Intercore Consulting, also has past performance in curriculum development from, we've also worked with St. Petersburg College there in Florida, and done some training as well for the local hospitals. So we would be very much interested in possibly the opportunity of assisting. So thank you so much for the presentation.
You bet.
Excellent.
Yeah, I think what we're looking to do is identify a group of people that wants to move in a similar area and come up with a way that we can make sure that everybody's getting some information and learning how to do this. I don't really know, but it's almost like, hey, if we're going to go after a growth market, I want to do it with a team and somebody that's already taking some initiatives. And I feel like the people that are showing up for GovCon Summit are like, I'm going to figure out a way. Because that's definitely what I perceived from you and Itri and from Olu and Ashley, and even Ron Benzeev, who had to drop off, because it's like every small business that I talk to talks about the same things being in their way of really the amount of effort it takes to get in front of an agency and present what you're doing. But Olu, when I look at the things, the programs you've got and what impact that has, the opioid crisis and violence against children, I mean, these are all super important things, and there's got to be a way to do some research and find what the pathways are. I think what our frustration has been, and when Ashley and I were working with this, is these contracts are either controlled by very large organizations, and honestly, they don't want to be bothered, or they are, it's almost like it doesn't seem like there's a way to crack in. Does that sound like what we decided, Ashley?
Oh, absolutely. And I'll give an example. So within DEO, the Department of Emergency Operations at the CDC. So there's various departments underneath that. And Olu works across several of the departments. I'm mainly focused on one, which is the capacity team that does all the international work. And what is so crazy is they're all, like, for example, in my area, they're hiring curriculum development specialists, and they hire them out of General Dynamics information technology. Well, I used to work for General Dynamics, so I thought, oh, well, let me see if I can find somebody I know. And I reached out to them, and they were like, well, you might want to try so-and-so. No, you might want to try so-and-so. No, you might want, and I was just like, okay. And so I met the curriculum developer, and why I met the curriculum developer is because she came to me because she didn't know what she was doing. And she's like, hey, I need your help on this. And I'm like, wait a minute, and so that's the part that I find completely frustrating is, you got this contract, but your people don't know what they're doing. That's just, anybody else on your experience that?
Mm-hmm. Certainly. Yes, absolutely.
It is the story of our lives. Muriel, I have Muriel, my senior director, on the call. Muriel, you want to chip in a little bit, some of your experiences, especially during COVID-19, how we were able to overcome it?
Yeah, hop in here, Muriel. Put your camera on. Get in here.
Look, I don't know if you all want to see me, but I'm going to turn it on.
Oh, we totally want to see you. This is what it's all about.
Can you see me?
Yes, absolutely.
Beautiful lady.
Hi, Ashley.
Hi, sweetie.
First of all, thank you so much for allowing me to be a part of this. This is wonderful. COVID has taught us so many things, but the one thing that it has taught us is that the show must go on. We still have lots of important work to do, and there are so many people out there in the US and other countries that need our help. And so, in working with Ashley, she has allowed us to be innovative, to take all of these curriculums, that we typically do in person and find technology to be able to still keep training people to be able to handle these emergency responses. And that is such a blessing. Because, in working with CDC, yes, they call us and they want us to come out and help them when these situations happen. But it's important for them to have the capacity to be able to contain and sustain these types of things before, the CDC and companies like SIS get there. And so it's just, like I said, it's such important work that we are doing, and I'm just happy to be a part of it.
Well, the other thing that Ashley and I had a lot of conversations on is that the other companies that might be interested in pursuing this would be those that have other operations already existing in Africa and other places, because in order to operate over there, you've got to have the licenses. You have to know what your banking regulations are. You have to have those things established. And I don't know how to do this, but the idea would be to identify some of those companies and kind of break it up and go after some of this as a group. And I think the main thing is never give up, right? Because we're doing this whether it's hard or not.
Jenny, that conversation that we have, that was early on when we first met last fall. And since then, Olu and Muriel have established a footprint in Africa, to doing business in Africa. And I think Olu, we joked and said, can't wait for that. We have the different offices in the different countries that we can travel to.
Exactly.
And Muriel and Olu are making that happen. And it's just amazing how well that they have done this in such a short period of time.
Well, and think about that. Where are they located, and where are those locations for you guys anyway? What cities?
We're happy to announce that we now have offices in Cameroon and Nigeria, and we're looking to expand, of course. But I will tell you, like, by no means are we the experts. We're learning by trial and error. Isn't that right, Olu?
Yes. So it has its challenges, and I think you said it quite well, the regulation in these respective countries. So again, we're looking at Abuja and Lagos in Nigeria, and of course the Cameroon. Currently, we are working on the Tanzania office. And one of the key reasons for those decisions really is to also help us expedite the rollout of emergency operations. Because one of the lessons learned was one of our fellows, there was a challenge in their countries during the COVID-19 epidemic, and they have to charter a flight, right, to get him back to his country to help their Ministry of Health. So by having foot on the ground, I think there's so much more we can do. And in doing that is really what we are doing right now in Lagos, that we're doing in Abuja for the Fellows Program, where all the countries are going to meet in Nigeria versus just coming to the United States.
Okay, well, this is great information. We're gonna have to stop now because we've got another session coming on,
Yes.
but I very much appreciate all of you as being a part of this. And I look forward to creating some momentum out of this event, calling this in general, I'm gonna call it the COVID Coalition, although it's obviously much more than that. What we're looking for is in communicating about what we're doing and where our goals are, is to say that we've got a unique set of small businesses that are engaged in this. So thank you all for being on today. And I look forward to hearing more again later. Any last words there, Ashley or Olu?
I am looking forward to hearing from the participants, whoever we can partner with. We are always looking for great partners. We're always looking for other small and large. Again, it's a global village and we are ready to roll. So I will look forward to those contacts. Thank you.
All right, well, very good. Thank you.